CVS said Wednesday it has agreed to pay about $5 billion over 10 years, and Walgreens said it has agreed to pay about $5.7 billion over 15 years. Neither company admitted wrongdoing. Walmart has agreed to pay $3.1 billion, mostly upfront, according to two people familiar with the matter. Paul Geller, one of the attorneys negotiating for the governments, said that comparisons to pharmacies will bring billions of additional dollars to communities that are desperate for funds to combat the epidemic of opioid addiction. We know that reckless, profit-driven dispensing practices fueled the crisis, but we know just as surely that with better systems in place and proper heeding of red flag warnings, pharmacies can play a direct role in reducing opioid abuse and in saving lives, Geller said. CVS General Counsel Thomas Moriarty said in a statement the company is pleased to have the claims settled and the deal is in the best interest of all parties, as well as our customers, colleagues, and shareholders. Walgreens said in a statement, "As one of the largest pharmacy chains in the nation, we remain committed to being a part of the solution, and this settlement framework will allow us to keep our focus on the health and well-being of our customers and patients, while making positive contributions to address the opioid crisis." Both CVS and Walgreens said their agreements would not be final until certain non-monetary terms were worked out and that the total amount could be reduced if insufficient government plaintiffs sign. Walmart did not immediately respond to a request for comment. The proposed settlement, which would be the first nationwide deal involving retail pharmacies, follows nationwide opioid settlements involving drug manufacturers and distributors totaling more than $33 billion. They said the resulting human toll, as well as the strain on public health services and law enforcement, was a public nuisance that businesses would have to pay to address. CVS, Walgreens, and Walmart are the top 3 retail pharmacies in the country by market share. If their settlement becomes final, it will end much of the sprawling, years-long opioid litigation, although cases remain pending against smaller, regionally focused dispensary operators, including Rite Aid Corp., RAD.N., and Kroger Co., KR.N. Plaintiffs had scored some significant litigation victories against pharmacy chains, including a $650.6 million judgment in favor of 2 Ohio counties against CVS, Walgreens, and Walmart, and a ruling that Walgreens contributed to San Francisco's opioid epidemic as. San Francisco is not included in the national settlement and is scheduled to begin a second lawsuit against Walgreens next week to determine how much the company must pay. State and local authorities have said they will use the money from the settlements to help fight the opioid crisis, which the federal government says has caused nearly 650,000 overdose deaths since 1999 and is getting worse. Prescriptions for opioids soared in the 1990s as companies aggressively promoted the drugs, long used primarily in cancer patients, as a safe way to treat all types of chronic pain. Opioid overdoses, including prescription pills and heroin, rose sharply during the COVID-19 pandemic, rising 38% year-over-year in 2020 and another 15% in 2021, according to the U.S. Centers for Disease Control and Prevention. The agency has traced much of the recent spike in overdose cases to illegally manufactured fentanyl, a powerful synthetic opioid. A congressional report last month put the economic toll of the opioid crisis at $1.5 trillion in 2020 alone.